Hello, my name is Michael Griggs. I am the Director of Clinical Services for Breas, and this video I'm going to go over the settings in some detail. Now the settings menu you'll find right here labeled Setup, and basically at this point I have the ventilator set in a volume SIMV mode. So if I hit my setup, okay, this is going to take me to my settings, and all the settings that you see here on your settings screen are going to be related to the mode of ventilation that you're in. So currently my settings for volume SIMV, I currently have a tidal volume set at 300. I have a PEEP of 5, SIMV rate of 12. My I time is at 1 second, and I have a rise time currently set at off. Inspiratory Trigger is at 3, and I have a flow pattern of descending RAM. My support settings currently are a pressure support of 10, a rise time of 7, and I've got an expiratory trigger of 3. So let's talk about some of the special things within the volume SIMV settings that are important to know. Okay, so first of all, highlighting or making any changes to your setting menu is just simply using your navigation buttons up, down, left, and right. So if I wanted to make any changes, let's just say decrease the SIMV rate, I can go ahead and highlight that, move the rate to 10. There is no enter button. It is just an automatic change at this point. Okay. Rise time. There is a rise time function in the volume mode. Okay, so currently the rise time is set at off, which means that I'm going to deliver that 300 tidal volume over the course of 1 second to the patient. Okay, but let's just say you notice that the patient is air hungry, and perhaps they need a little more flow, or they need the tidal volume to be delivered a little bit faster. If there's a reasoning that you cannot necessarily manipulate your rise time or your inspiratory time to accomplish that, you do have the option of a rise time function for delivery of that breath a little bit quicker. So my settings for my rise time are either 90, 80, 70, 60, or 50. All right, so what this means is that tidal volume of 300 mLs is delivered over the course of 1 second, but my rise time is now set at 50%. And now this means that my rise time, I'm going to take 50% of my inspiratory time, and that's going to be 0.5 seconds. And that is now the delivery rate of that 300 mLs. Okay, so I'm now delivering the 300 at 0.5 seconds because that's 50% of 1 second. Okay, now what happens to that other 50%? What happens to that other 0.5 seconds? What happens is that you get an inspiratory hold. Okay, so inspiratory hold, if the patient is able to tolerate that, it has been there's been studies that have shown that an inspiratory hold maneuver does help with oxygenation, as well as improve, in some cases, can improve ventilation to the patient. But if the patient is air hungry, the purpose of that rise time is to try to give the patient a little extra boost of flow, try to get that volume into their lungs a little bit quicker. Now, that's 50%, and that's as low as it'll go. So at 60%, basically now what you're looking at is a 0.6. Okay, 60% of 1 second is 0.6 seconds, and you would have a 0.4 second hold. Here you would have 0.7 and 0.3. This would be 0.8 and 0.2, because you are using that inspiratory time as basically the total cycle time. Okay, or not the total cycle time, but the total inspiratory time. I apologize. Okay, so that's the function of the rise time in volume ventilation. So by turning that rise time off, my 300 is now being delivered again in 1 second. My inspiratory trigger, you'll see that my inspiratory trigger, if you look from a visual standpoint, very, very sensitive at 1, and I can make it very, very, well, I don't want to say very not sensitive. Let's just say it's less sensitive at a setting of 9. Okay, but as you can see by manipulating that inspiratory trigger, a setting of 1 is going to be more sensitive, and then a setting towards 9 is going to be less sensitive. Something else that is important to know when you're talking about a support pressure, okay, these are your supported breaths. So in SIMV, we're going to be basically setting a pressure support for your spontaneous breaths. Now, you'll notice that this says support pressure. So, excuse me. So what we're going to be setting here is a total pressure. Okay, so I have a PEEP of 5, and I have a support pressure that's going to be delivered of 10. Okay, this is not a pressure support. It's not labeled that way. It's labeled support pressure. So what's important to know here is that this value of 10 centimeters of water pressure, this is what's going to be delivered to the patient during that spontaneous breath. Okay, now what that means is that I've got a PEEP of 5 and I've got a support pressure of 10. This means that my total pressure support during that spontaneous breath is going to be a total of 5. So a support pressure of 10 is giving me a pressure support of 5 because I have a PEEP of 5 and my total support pressure is 10. The difference between the two is your total pressure support. Okay, so it's very important. So if a physician says, you know, I want an SIMV tidal volume of 300, a PEEP of 5, rate of 10, but I want a pressure support of 10 over 5, then we need to know that we need to set our support pressure at 15, okay? Because that is the difference between, your pressure support is the difference between that support pressure and your PEEP, okay? So important to know, all right? The rise time, you do have the ability that during those pressure supported breaths, you can deliver faster or slower rise time. And then you also can set your expiratory trigger as well. The expiratory trigger is a flow termination. It's used during, you want to make sure that the patients are cycling close to their neural cycle. So you want to take a close look at that expiratory trigger as well. This setting here would show a 10% drop in flow. So your expiratory trigger setting of 1 would be 10% drop in total peak flow, and the ventilator will kick into the expiratory phase. In this case, a setting of 9 would be you would need a 90% drop in total peak flow before the ventilator cycled into the expiratory phase. A setting of 9 would be more appropriate for your restrictive diseases because you want to make sure that you have enough time to deliver what you want to deliver, okay? And then a setting of 1 are be more your obstructive diseases. You want to give the patients more time to exhale, so you want the ventilator to be able to allow that to happen. Okay, so these are your settings for volume, SIMV. Very quickly, I'm going to go into the mode menu here, and I'm going to place the device into pressure support. Okay, just so I can go over some of the significance with regards to some of these settings that are important to know. Okay, so in this case, your inspiratory pressure, I have an inspiratory pressure set at 30. I have a PEEP of 5, and I have a PS calc of, well, I'm just going to confirm. We'll get our settings set up here. Okay. So I currently have a peak inspiratory pressure setting of 30. you'll see that the ventilator is delivering a peak inspiratory pressure. So you do not, this is not a pressure above PEEP. You're setting an inspiratory pressure. So my inspiratory pressure is 30, I'm delivering 30, I have a PEEP of 5, which means my pressure support, or my calculated pressure support, you'll see, is at 25. That's the difference between my inspiratory pressure and my PEEP. Okay, I currently have a rise time of 4, inspiratory trigger of 3, expiratory trigger of, we'll just say 3. I have a min and max I time setting of off, backup rate of 10, okay, and backup inspiratory time of 1. So let's go over some of these, the important settings in the pressure support, okay. One of the things I want to make sure that people understand is your min inspiratory time and your maximum inspiratory time. These are important for synchrony. You want to keep these settings in mind because when you're in pressure support, the patient, when you're in a pressure support setting, the patient has all the control. I mean, as far as the initiation of a breath, they also have control over the cycling of a breath. But with these types of settings, we can kind of help with the synchrony as well. If the ventilator and the patient aren't working smoothly, we can do some things here with the min inspiratory time and the maximum inspiratory time to help with that. Okay? So for instance, if you want to make sure that the patient, let's just say they're cycling too quick, okay? For whatever reason, let's just say they have a restrictive process going on, and the ventilator is peak pressuring too quickly, or perhaps the tidal volume goals that you have set on the machine, the patient is not receiving. Okay, so by setting a min inspiratory time, you can kind of control the fact that, hey, look, I want that ventilator to at least give the patient enough time to get what they need to get, okay? So in some instances, you can decrease your pressures to the patient in some cases. Because you're telling the ventilator, hey, look, I'm going to give you some more time to provide, I'm going to provide you with enough time to get that pressure or that tidal volume into your lungs. So don't forget the importance of that minimum inspiratory time. Maximum inspiratory time, you can also tell the ventilator, hey, look, I want to make sure that we have enough time to get that ventilation in, but if it's taking too long, I also want to give the patient enough time to exhale. So we can also set a maximum inspiratory time as well. And this is, for instance, let's just say the patient has a leak. Okay, sometimes the inspiratory time can be extended because the ventilator is too busy trying to overcome that leak, and the inspiratory times can become extended. So in these situations, you may find that the patient is trying to exhale and the ventilator is not allowing them to or not letting them. So we can help out with that by setting a maximum inspiratory time as well. Okay, now you'll notice that I have a min inspiratory time of set at 0.5 and I have a maximum inspiratory time set at 1.7. If the patient wants to cycle at any point within those two parameters, they are more than capable of doing so. But you're just telling the ventilator that, hey, I want at least 0.5 seconds and I don't want to go any longer than 1.7. Okay, and that's just an example. All right. Another important note is that the backup rate. The backup rate in pressure support, okay, is based on a spontaneous effort. So if the ventilator does not recognize a spontaneous rate higher than 10 breaths per minute, then the backup rate kicks in on the machine. The backup inspiratory time, when the backup rate is being delivered, you can set that backup I time as well. Okay. Last thing I want to talk about in the settings is the target volume feature. Something that you may or may not be familiar with, but our target volume feature is our volume guarantee feature. Okay, so I know that a lot of people may have heard of AVAPs or the Trilogy's feature, our volume guarantee feature. Our volume guarantee feature is called target volume. Okay, so basically what we're doing is we are going to be in pressure ventilation, okay, but we are going to guarantee a tidal volume of 300 to our patient. So one of the things that you may notice right now is that I'm delivering a peak pressure of 30 and I've got a tidal volume of about 580. All right, so what does the ventilator need to do in order to achieve a target volume of 300? Well, it needs to start dropping, it needs to start dropping its peak pressure in order to make that tidal volume go down to 300, okay? But it's not, okay? And the reason why it isn't is because our max pressure is set at 30 and our minimum pressure is set at 30, all right? So I am going to highlight my min pressure and start dropping that min pressure. Let's just drop that down to 15. So one thing that you may notice now is that the ventilator is going to start dropping its peak pressure on a breath-by-breath basis in order to achieve that tidal volume of 300. Okay, it's going to take a little bit to get there because the algorithm with regards to our target volume feature is the same algorithm as PRVC, pressure regulated volume control. So what the ventilator is doing is it's delivering a volume or pressure at 27, and I'm getting a tidal volume of 500. Okay, so on the very next breath, the ventilator is going to decrease the pressure, a half a centimeter of water pressure, and then look at the tidal volume again. And it's going to continue doing this, dropping a half a centimeter of water pressure per breath until the tidal volume is achieved. Okay, so that next one will be 24 and a half. We're at 439. The next one will be 24, and we're at 426. The next one will be 23 and a half, and we're at 414, and so on and so forth. Okay, so that's the target volume feature on our device. So again, the algorithm is it's going to look at the previous breath and it's going to make a pressure change, a half a centimeter of water pressure up or down if needed on the very next breath. Okay, so we're getting pretty close to the 300. Probably going to be about 19, I'm guessing, maybe 20. Okay, so we're almost there. So right now it shows that the peak pressure to deliver 300 is probably about 19 and a half or 20 or so. Okay, so, yeah, excuse me. So we have a peak pressure of 20 to deliver the 306, okay? And what I'm going to do is, basically, to set my max pressure appropriately and my min pressure appropriately, I'm going to find out what my peak pressure is to deliver my target volume, okay? So I've got a target volume of 300. I'm getting 300, and it's taking a peak pressure of 20 to get there. So what I'm going to do is I'm going to set my max pressure at 30, which I've done, okay? And I'm going to set my min pressure at about 15, which is also where it's at, okay? And that's kind of my suggestions as far as where to set that max pressure and my min pressure. All right. So this is the settings for my pressure support with target volume. If I want to turn that target volume feature back off, I just simply highlight it and turn it off. And now you'll see that I'm back at 30/5 and a pressure support, calculated pressure support at 25. Okay, so these are the settings for pressure support, and I appreciate the time as far as going over the settings. One last thing I want to go over is also that you'll see there's a 1 with a 2 in parentheses. This simply means that we're on page 1 of 2 pages of settings. Since I'm in the setup menu, I'm going to press the setup button again, and this scrolls me to page 2 of 2. All right. So on page 2 is a sigh function. You do have the ability of turning the sigh function on or off. If I turn it on, it allows me to set a sigh rate of every 50 to 250 breaths, and also will allow me the ability to dial in the size of my sigh breath, 125% all the way up to 200%. And it also will calculate your peak pressure for that sigh breath as well. Okay, so that's page 2 of 2. If I hit the setup button again, it takes me back to page 1 of 2, and these are the pages of my settings. Thank you very much for your time.